I'm Dr. Sandeep Jha. I'm a liver disease specialist and a liver transplant surgeon, and I work as a consultant at Manipal Hospital, which is in Dwarka, Delhi, India. In my earlier video, we have discussed the what, when and how of fatty liver disease, and in this video, we are going to discuss how to diagnose and manage fatty liver disease. So, the most important question to answer in any case of fatty liver disease is if it's a simple deposition of fat, which is called a simple steatosis, or is there ongoing liver damage which can be seen on a liver function test that will show elevated AST, ALT or SGOT, SGPT, or the doctor might ask you to perform a liver biopsy to see if there's any evidence of ongoing liver damage. And the third question to answer is if the patient has fibrosis or cirrhosis, and the doctor can make the use of a fibroscan, a CT scan or an MRI to answer such a question. Now, a fibroscan is a very easy investigation to do. It can be done in 15-20 minutes. It's like an ultrasound machine. It is more easily available and less expensive than a CT or an MRI. So usually the first investigation that a doctor orders is a fibroscan if he's suspecting a fatty liver disease. And this fibroscan is able to tell us the exact quantification of fat in the liver and also if the liver has any fibrosis or not. Now, the CT and MRI is also equally effective in showing us fatty liver disease, and the doctor might want to order CT MRI if he suspects any other cause or he strongly suspects cirrhosis. Then a CT or MRI might be the first investigation that he orders. Ideally, a liver biopsy is required to diagnose or confirm NASH or NAFLD, but in practical scenarios, usually ultrasound, LFT and CT scan or MRI usually suffices to form a diagnosis of NASH or NAFLD, and biopsy is only required in rare cases. Based on these investigations, we can classify a patient as NAFLD, that is non-alcoholic fatty liver disease, or NASH, a non-alcoholic steatohepatitis, or a case of liver fibrosis or a case of liver cirrhosis. If I may oversimplify for the sake of understanding, a NAFLD or non-alcoholic fatty liver disease is a simple deposition of fat on the liver, whereas NASH, non-alcoholic steatohepatitis, is a deposition of fat on the liver along with evidence of ongoing liver damage on an LFT or a biopsy. And liver fibrosis is irreversible changes in the liver, whereas a liver cirrhosis is permanent damage to the liver, is called as liver cirrhosis. So if you see more than 90 to 95% patients of initial fatty liver will be either NASH or NAFLD, and only 5% of the patients will have liver fibrosis or liver cirrhosis after these investigations. We'll move on to the treatment part of these conditions. Now, NASH or NAFLD, if you have any underlying etiology of NASH or NAFLD, the most important aspect is to recognize that underlying etiology and treat it. Now, it could be chronic hepatitis B infection, it could be chronic hepatitis C infection, it could be uncontrolled diabetes, it could be uncontrolled obesity. Patient might have to undergo bariatric surgery to control his obesity. It could be dyslipidemia, or the patient could be on any chronic medication that could be causing the liver damage. It could be allopathic medication, it could be Ayurvedic medication, it could be homeopathic medication, or it could be any of the numerous health supplements that is freely available in the market, and that could be secretly damaging the liver. So we have to stop these medications, and also the patient has to abstain completely from alcohol because that could also be contributing to the liver damage. If the patient has NAFLD, that is, he has only fat deposition on the liver but no evidence of ongoing liver damage, however we don't have any etiology why this fatty liver has happened, then we might have to look at the rare causes of liver damage, which are numerous, and we have to judiciously rule them out one by one. If we still find no etiology of NASH or NAFLD, then the most important intervention is, like I said earlier, quitting of any unnecessary drugs or scrutinizing them and stopping any drugs that is not necessary to the patient. It could be allopathic, Ayurvedic, homeopathic, or any of the health supplements. Also, abstaining completely from alcohol is mandatory. Other than that, the most important intervention is lifestyle modification, which includes weight loss, which includes exercise, which includes dietary modification. In weight loss, if the patient loses 5 to 10% of his body weight, there is significant reduction in fat content of the liver. And it is said that if an obese patient loses up to 30% of his weight, then the fatty liver can be completely reversed. Now, these patients have a condition of insulin resistance, that NASH or NAFLD has developed due to insulin resistance, and the body is not able to metabolize the lipids in the body, and hence they get deposited in the liver. Now, exercising can reverse this condition or control the insulin resistance so that the patients are better able to metabolize the lipids or fats, and fatty liver can be controlled. The third important intervention is dietary modification, which can significantly impact fatty liver disease. Now, if the patient has NASH, that is deposition of fat on the liver with ongoing evidence of liver damage, but no known etiology that is causing this liver damage, then the important interventions are absolutely abstaining from alcohol so that any contribution to the liver damage can be controlled. Secondly, we have to stop any unnecessary medication that may include allopathic medication, ayurvedic medication, homeopathic medication, or any of the numerous health supplements that are freely available in the market and that could be causing the liver damage. Other than that, there are few drugs that are available that can control the fatty liver and have been approved by various boards across the world. It includes vitamin E capsules, it includes pioglitazone, it includes saroglitazone, it includes omega-3 fatty acids, and liraglutide, and many experimental drugs are under investigation that have shown effect in controlling the fatty liver. So if you think you have fatty liver and you require medication, then you should consult a physician who can evaluate and advise if you need these medications, and he can prescribe to you. Now, the last condition is if you have been diagnosed with cirrhosis, and in such a condition your doctor might order liver biopsy to confirm if it is early fibrosis or cirrhosis, which is very important to the prognosis. If it is early fibrosis, then the above mentioned interventions can improve your fatty liver and reverse any damage to the liver. However, if it is advanced fibrosis or cirrhosis stage, then management approach changes slightly and you have to be under surveillance for prolonged time, and it can impact your overall prognosis. So if you think there was important information and beneficial information in this video, then please share, like, and subscribe to this channel so that more and more people can benefit from this information. Thank you.